Te Hiringa Mahara, the Mental Health and Wellbeing Commission, has released its report exercising rangatiratanga during the COVID-19 pandemic, which finds Māori-led initiatives played a key role in protecting the health and well-being of communities during the global pandemic. Te Hiringa Mahara Director Māori, Mariah Johns from Ngai Tūhoi, is with us now. Tēnā koe, Mariah. Thank you for joining us.
Tēnā koe, Neil. Kai te whai. Kia ora koutou.
Now, in the face of COVID-19, what did Māori initiatives do that played a key role in protecting whānau?
Oh, Neil, they provided the culturally relevant and really appropriate supports to protect and keep our whānau, hapu iwi and their communities safe. And that was really done in a really uniquely Māori way, and that was through exercising of rangatiratanga. When we talk about rangatiratanga, obviously there's that understanding. It's time-honoured knowledge and practices from the beginning of time. Our tipuna ancestral teachings, and you were just mentioning before, from pūrākau learnings from our ancient stories, our tikanga, our kawa, and that resulted also in adapting our tangihana protocols to keep whānau safe. But that's always underpinned by our many Māori values, and some of those ones were around kaitiakitanga, rāhui, whakapono, manaakitanga, whanaunatanga, and kōrero, tuku atu, tuku mai, sharing of information and the dispelling of misinformation and disinformation to our whānau, which was quite a big issue early on.
Well, because there was so much distrust. There was so much distrust. Right. We had to rely on some of these networks to ensure we were getting the right information. So how were some of these Māori networks able to work effectively to navigate such a turbulent time?
There were so many of our Māori networks that worked really tirelessly during this time, and we saw hapu, iwi, marae networks looking after the needs of their whānau and communities in their respective rohe, you know, through delivering kai to their doors, to maintaining connections with our whānau. And that, when we say whānau, it's both Māori and non-Māori whānau, providing food parcels, rongoa to the doors, kaumātua and tohuna, providing spiritual supports through Zoom, karakia online, and I certainly joined them myself, and providing Māori mindfulness wānanga. It was amazing. So across the motu, we saw that there were kaupapa Māori providers, tōkana nteina, specialised in primary mental health and addictions from a te ao Māori worldview. We saw our whānau ora providers, our hauora Māori providers, and to mention, we had Manatu Hauora, Ministry of Health, Māori Health Director, John Whana, and the Ropu and team there, providing a range of resources, constant, consistent, and trusted information to the Māori health sector as a whole. So through that exercising of rangatiratanga, Neil, it remains an effective response from Te Ao Māori to the COVID pandemic because they were able to really mobilise quickly. They were agile, they were adaptive, they knew their communities, they were trusted by the people that they were serving. But basically, Māori do know what's best for Māori. And what's good for Māori, good for Aotearoa.
Mariah, how do you feel that adopting an equity lens helped in the responses to COVID-19?
Oh, it only helps because Māori leadership at various levels took that additional action to meet whānau needs, knowing that the national pandemic responses may not necessarily meet those needs. It helped in the roadside checkpoints. You know, it was invaluable. The sharing of information, the spelling of misinformation, disinformation, as well as managing the access to rohe in helping to stop further community spread of COVID. Those Māori networks previously mentioned, Neil, maintaining all their supports to the people, including that critical information throughout and even beyond the lockdown period, organising and delivering those resources, creating and maintaining connections through that online and digital technology. It was really, really amazing.
And how do you feel that these findings help Māori to continue to deliver for their communities in this post-ish COVID world?
Well, these findings really, it requires us to continue to advocate for rangatiratanga to be recognised, to be valued and trusted, to be equitably invested in, and to be actioned. We need to urge for equitable and robust future government decisions that has Māori, their tiriti partner, rightfully at all levels of decision making, and to support government to totally optimise better health and wellbeing outcomes for Māori, being an integral part of the realignment of health system processes and advocating and sustaining resources for Māori rangatiratanga as described within our report, so they can continue to provide support to their communities.
And we know that what works for Māori doesn't only benefit Māori. How will others be able to benefit from these initiatives?
We know Māori knows what's best for Māori, but exercising that rangatiratanga is not new. And we also know that what is good, what helps Māori will help other whānau within Aotearoa. So providing the sustained support and resources for Māori is absolutely critical. Opportunities to truly build partnerships are abound with the government, but the government actually need to trust and to be trustworthy in their approaches. So future government decisions regarding health and wellbeing can be built upon only by including including Māori as the te tiriti partner and as their decision makers.
Beautifully said, beautifully said. Te Hiringa Mahara, Director Māori, Mariah Johns, thank you for your insights today. Ngā mihi.
Pai te pai, nō ora mai.